Good morning, fellow Rotarians. It's good to have you all here this morning. Sorry for the short notice for this section, but we felt it's a very important one to go. This is the month of July, and the month of July is the month of maternal and child health. So, and we have gotten two seasonal speakers, well seasoned, to facilitate this section this morning. Learning is a continuous thing. We can never have enough of knowledge, and knowledge we know is power. Knowledge is key in every organization. If you don't have knowledge, then you have not started. And it is never enough for what you know. For every learning section, there's always something to take home. There's always something to learn. And this morning, we have two seasonal speakers, our own revered past district governor, PDG Dende Shoga. We thank you for finding time within the short notice to be with us this morning. We appreciate you. We also have PP Shego Akinwotu also to take on another topic this morning. We thank you, Shegu, for finding time to be here with us this morning. I want to appreciate everyone that is online this morning and even those that are yet to join. I want to plead with us when we start, we keep to time so that we make it short and interesting, both for the speakers and for the learners that will be here this morning. So after this section, we'll have enough time to go about our normal activities for the weekend. So once again, I appreciate you all. The moderator for this section today will be my deputy learning facilitator, PAG Shego Adewoko. He'll be there here this morning. He's already here to moderate the section. I'd like to call on my district governor, Lijilaye Abidoye, to give us an opening remarks for the section. Thank you, my dear.
PDG, our referred learning facilitator, we thank you for making this happen within a short period of time. And we also thank everybody who has joined, even if the notice is short. We can never thank you enough. We are here to do the first in the series of our online monthly learning. And I wish to thank all our leaders who are here. And I wish to thank everybody who has agreed, who has joined. On why child and maternal health, we should understand that one of the biggest programs going on in Africa is the one child and maternal health, in which one just completed and another one being put together. And this month being the month of emphasis for child and maternal health, we can never say enough about it. And one of the legacy projects for the district for this Rotary year, and the first of the series of the project was done in Island Maternity Resuscitation of the infants, and then stopping of postpartum bleeding by mothers after childbirth. And even in line with that, another one is even planned at the Naval Dockyard for 23rd. So we cannot do enough by even learning. But this is, I hope now we start and we continue. On this note, I wish to thank the facilitators who have agreed to facilitate, PP Akinwotu and my referred as the governor from my club, Dende Shoga. Thank you very much for agreeing to facilitate. I implore everybody to listen attentively, take your questions, so that at the end we can save time. We take all the questions at once so that we can all enjoy this learning session. It's learn, and thereafter we go ahead and make a lasting impact in society. Thanks for coming, and I wish us a very beautiful and impactful learning session.
Thank you very much, my DG, for this wonderful opening remarks. This is a very important month, maternal and child health. We have a lot of mortality in these areas, and whatever we do in this month will never be overemphasized, will never be too much. Thank you for these remarks and for all you plan to do for this month of July. I would like to now call on PAG Adewako, my deputy, who is going to be the moderator for this section, to now go ahead to call on the speakers and introduce them properly for us to start. Thank you very much. PAG Shego, over to you.
Thank you very much, my dear Lefman. Good morning, my DG and fellow Rotarians. As earlier emphasized, this month is a month of membership, is the month of maternal and child health. And for our online training sessions, we have brought in two well-seasoned Rotarians to come and talk to us on this topic. We have our highly revered PDG Dende Shoga and past President Shegun Akinwotu. Our first speaker for today will be PDG Dende Shoga, who will be talking to us on leveraging communities-led initiative and vocational training to reduce neonatal mortality on underserved areas. PDG Dende Shoga is a prominent Nigerian orthopedic surgeon and a highly distinguished past district governor of our district, District 9112. He is widely recognized for contributing his medical expertise with decades of passionate humanitarian service. He rendered many meritorious years of service at Lagos State University Teaching Hospital, LASUT, in Ikeja, where he also taught medical students and surgical residents. He subsequently established his own orthopedic hospital in Ikeja, Lagos. He's a dedicated Rotarian since 1994 and is a long-standing member of the Rotary Club of Bagada. He served as district governor for Rotary International District 911, the defunct District 9110, and is a prominent member in our new District 9112. He was awarded the prestigious Rotary Service Above Self Award in the year 2017. He has served as a pivotal international partner and volunteer for Alliance for Smiles, leading their missions in Nigeria and helping to establish a treatment center at Lasut. Dr. Dende Shoga continues to be an active and sought-after speaker for community-led initiatives, vocational training, and maternal and child health programs in Nigeria. Distinguished Rotarians, I present to you our first speaker for today, PDG Dende Shoga. You have the floor now, sir.
Good morning, this is Governor. I hope I'm on meeting. Yes. Good morning, this is Governor. PDG fellow Rotarians. You're welcome to this session. And my business in the next 2 minutes is to discuss how we can leverage community-led initiatives and vocational training to reduce the data mortality. We are, like we were told, in the month of July, which Rotary has kindly dedicated to the issue of maternal and child health, which happens to be one of our 7 areas of focus. So our emphasis this month on serious training pertaining to maternal and child health, which is a very wide topic, and we're only trying to address a little part of it. If we actually spend the whole year addressing maternal and child health only, we say we will not have covered the topic enough, because it's a big problem in our society. Children are dying after birth. Some don't even get born alive. Mothers are dying while pregnant or soon after childbirth, and those are things that should be of great concern to anyone. Rotary, as we all know, has paid a lot of attention to this, especially in our environment where it's a big problem. For instance, what Rotary has done has gone to the extent of establishing a method for tracking maternal and child mortality in Nigeria and in the whole of Nigeria. And several clubs are also doing different things. But my focus this morning is on the issue of neonatal mortality, which is an aspect of the bigger subject, and how community-led initiatives and training can actually help us to mitigate some of these problems. In spite of the fact that we are celebrating or talking about maternal and child health in July, it does not mean it will end in July. Even in the other months, with other focuses, it will still continue to address these issues, because it can be the big subject that cannot just be set aside or taken like next slide. Now, in addressing this subject, I've attempted to take out a few keywords and talk a bit more about them as a way of actually seeing how wide the subject is, and in the course of it, it tells us many things that we can actually do. One is the community. We as Rotary clubs are blessed with the opportunity to actually have clubs in different communities. It will be difficult, for instance, for the district alone look at Lagos State and say you're going to penetrate the different communities. It can be achieved, but we already have the answer, which are our clubs. The presence of the clubs in different communities, therefore, has made it easy for us to penetrate different communities, such that the message reaching different areas of the state, of the district at the same time. And if we're therefore going to be able to take advantage of our presence in community to spread this message, there are a number of tools available to us. We're all familiar with the approach of reaching out to the community to get their buy-in into whatever we want to do in this community through our needs assessment process. This same process we can adopt such that we have direct approach to leaders in the community, the men, the women who hold the key in this matter, and other stakeholders in the community, the youth, and even the children, and everyone in the community. So we have the opportunity of actually directly approaching the community through our different clubs, just in the same way we try to make friends with them and then they are buying into our activities when we do this assessment. We also need the buy-in of the community to be able to achieve getting their support to significantly reduce the data mortality. Therefore, this age-old method is one that can comment for different clubs in reaching the community. When you do, and the communities accept, a number of the things that the desire to do, they will actually be the ones, going ahead and pushing the problem, because they would immediately begin to see how, problems they seen as impossible. They no longer have, in most societies, babies die, and people just shrug their shoulders, and they talk about Abiku and all that, and hope they will have another one. But they don't have to lose any. When they now see that things are changing, their children are no longer there, definitely they will take ownership of what they're teaching them and make sure they put it to practice. We also need to approach them because the community cannot do it alone, and we cannot do it alone. We need approach through government agencies, private health centers, and other health facilities around us, because the services will take place at these facilities. They therefore have to be on the same page with us. Other local health personnel, government agencies at higher level. Next slide. Okay. Then also, direct and indirect educational opportunities through our messages in the media, the TV, the radio. These facilities also go a long way in modifying attitudes and beliefs in society, such that our message further permeates through the community. Of course, when we discuss racial mortality, we cannot completely achieve our aim without talking about issues that concern the women, because the mothers have to get pregnant, they have to carry the children, through during pregnancy, they have to deliver them and look after them, not just them, breastfeed them, and so on and so forth. And it is the women who make all this possible. Men, I would say, are just passengers in this matter. Therefore, we cannot, completely discuss this without also talking about the health and, well-being of the mother. Another method that has been used, in the past, especially by McLeod in one of his projects, carried out relating to maternal and child health, is what is known as community dialogue. It's an opportunity to actually involve community leaders, especially the men in the community, about issues that pertain to health of their wife, the health of their children. Because you find out sometimes that even the father could be the obstacle to some of the things that the mothers need to do to make themselves and their children healthy. The man who wants his wife to have a baby every year, will be working against him. The man who opposes the wife, getting immunized, or even going to medical clinic and all that, is going to be against him. So community dialogue is a great tool where we actually gather men in community and talk to them about issues relating to the health of their wife. And these are these how this also relates to the health of their children. And that bit of means we have to be discussing issues also relating to medicinal status of mother, while the babies are growing inside them. And even subsequently, for the woman who is malnourished, even if she gives breast milk, and just be almost giving water to the child. And then, of course, addressing issues of health concerns in the mother, for instance, keeping disease like malaria and similar things at bay, so that a healthy mother will then start healthy children. Vocational training as a tool to improve the uptake of our message is also a very important matter. When we, like the saying goes, when you educate a woman, you educate a village. At the same time, when you empower a woman with marketable skills and ability to earn money on her own, she becomes a better woman. She's going to be able to raise children who are healthier, who are more brilliant, and who are going to be hope of the general society in the future. A woman who, for instance, who sits at home doing nothing, who is now empowered with skills, will be able to be capable of some independent thought. When they come for such training, they will meet their peers. And, they will learn new things because they not only learn the trade, but also think about society and, different things that ultimately help them to become better models at the end of the day. They have greater financial leverage. I mean, they can provide for these children without every time running to the husband who will always say, I have no money. Sorry to say. But that's the usual story. So the woman can actually take steps to look after herself and look after her child without waiting for the husband. So vocational training becomes a tool, therefore, for making these women, and through the training opportunities and all, at the same time, issues relate pertaining to their health will also come in, even in our own discussion. So it becomes buy one, get one free, as we say. Mothers who have some level of education and empowerment are likely to be less influenced by harmful cultural practices in society. A number of cultural practices in our society that ultimately work against the desire to keep women healthy and survive that difficult period. For instance, a woman who, out of ignorance, takes her child, female child for female genital mutilation, or the one who goes for circumcision of the child in unhealthy places, and before you know it, the child develops tetanus, or those who will go for tribal mass, in unhealthy situations, and many other things. For instance, a woman who refuses to breastfeed the child because they say if she has sex with her husband, then likely to be passing the semen to the child in the breast milk. And therefore, because she wants to satisfy the husband, she starts breastfeeding the child. The number of several of them harmful cultural practices, which the opportunity of bringing these women together to train them can also go a long way in debunking some of it and making them to do the right things that are good for their children. And such women are also certainly likely to invite healthy advice more. Neonatal mortality is a neonate, is a baby newborn in the first 4 weeks of life, first 28 days. This, as we all know, is a particularly delicate period in life. I recall when, before I started studying medicine, when I see babies, it looks like they break a tooth and you see people holding it. They are so delicate and they are actually adjusting to the physiological demands of living in this world like us and not where they were protected in their mother's womb for 9 months. So it's a very delicate period, and the way it's handled, you know, it goes a long way in determining the future of those children, whether they live or die. Even some, when they don't die, whether they are truly healthy and wholesome children. A number of things can happen during that period that can, affect them, and they become infertile the rest of their life, or have some deformities and so on and so forth. So a good number of problems in that neonatal period can also be traced to the mothers in the first place, because some events during pregnancy can go along the way to actually affect what kind of child is delivered at the end of the day. Nutrition of the mother, poor nutrition, and lacking some things in their diet, some elements in their diet, to bring about deformities in such babies when they are born. Good antenatal care goes a long way. The woman gets immunized, especially against tetanus and so on and so forth, which offers protection to that baby when the baby is born. The kind of medication is taken by the mother during pregnancy. The events that surround the child, for instance, a child who was delivered maybe the church, and if you have a lot of that, delivered who think they'll be delivering the baby under the protection of God, delivering the church, forgetting that God is also in the hospital, and it's even working better in that place than inside the church. Or those who will go to traditional back attendance with their, poor training. And the mother is in labor for days. By the time the child is born, either dead or born limp, because there are the difficulties with delivery. So events surrounding the childbirth also go a long way, in determining the health of that neonate, and ultimately what becomes of that child. Those government have, in the forefront of some projects that address even the issue of community birth attendance. They are difficult to eliminate, but in trying to accommodate them, a lot of training is going on in places, Lagos and the rest. So actually train these birth attendants so that they know they are real. They know when things are getting out of hand, and they're working hand in hand with health facilities so that they quickly send these children and these mothers in labor who are having difficulties where they will get, to convince some mothers who must deliver the section, for instance, and then to take that action instead of saying, I only deliver naturally, and in the end, put themselves and their children in danger. So, what we've been discussing in the last few minutes is ways in which we can actually reach the community and get them to invite our message, and not only invite our message, but also to put them to practice so that maybe some of the problems neonates and even the children who are connected to later period are going through, and there's a lot that we can do as a parent But we cannot do it alone without the community. If we think we can do it alone without the community, we'll be like another man and go enter the street and the changing is there like, making some predictions of announcement. Everybody just play and go on, and nobody is taking the message. But if indeed we, approach the community as one of them and make them see our message and gather them, our message is likely to, challenge the community and they will invite what you're saying and ultimately work with us to improve survival of newborn babies through what we do for their mothers or we do for their children. All hands must be on deck and fellow parents if you're really going to make that difference. It should be a district-wide, pronouncement as it were, with guidance for clubs to actually reach out into communities where they exist, such that we can make this difference. We can work together singly as clubs. We can work as groups, and we can expand our capabilities within district grants or even global grants. A district-wide global grant, for instance, where so many clubs, have a hand in it, a voice in it as it were. They are taking the message to their different clubs. We go a long way in ensuring our message goes to a wider audience instead of just a few clubs, making their small drops in the ocean. We can actually make it a shower and get different clubs now take it to their community, and that way we'll be making it desired impact. Use of global grants for this purpose can increase our impact on the community. And of course, examples also of what some clubs have done, for instance, like M.O.R.E Golden that has equipped a medical facility, a government medical facility, with equipment to support the medical care, incubators, several other things, to help these students to survive. Then still talking about vocational training, you can also do global grants and vocational training teams who can be brought in and provide a future opportunity for caregivers who are relevant to medical care, the doctors, the dermatologists, the nurses, and everyone else that is involved. And they can learn new things, acquire new equipment, such that different facilities can actually, be so blessed through Rotary. Our College Club of Maryland and Continent has what they call transport ambulance, so that a newborn needing help, in a bigger facility can be transported in an ambulance with all the comfort as it were they were in a big hospital and they are around their life. The subject, my dear friends, is endless, but there's a lot we can do by starting. Starting is the key. If we keep talking about it and don't take the necessary action, we just face them. So this is the challenge before, and I think we should take it up from there. Because when we do actually take care of mothers, take care of neonates, and help them to survive, we'll truly be making a lasting impact. Imagine children born today who are, in a vulnerable state and help them survive. And their life for the next 50 years, isn't that lasting impact? There are things we all can do more in creating lasting impact by reducing the maternal mortality in our community. Thank you for listening. We'll take questions later.
Thank you very much, PDG, for that educative session. I'm sure we all got a lot of information from this topic. And just for the benefit of everybody, I would like just to give a recap of what you have said in just a minute. The facilitator said that Rotary clubs should work closely with community leaders, healthcare providers, government agencies, and local stakeholders to improve maternal and neonatal health outcomes, and that women empowerment through vocational training is key. So equipping women with vocational skills enhances financial independence. It promotes informed health decisions, and it reduces harmful cultural practices that contribute to maternal and neonatal mortality. The facilitator also said that quality maternal care saves newborn lives. That is, good maternal nutrition, quality antenatal care, skilled delivery, and proper postnatal care are critical determinants of neonatal survival during the first weeks of their lives. He also said that education and advocacy drive behavioral change. Continuous community education through dialogue, media campaigns, and the involvement of men helps eliminate harmful practices and encourages earlier maternal and newborn care. And finally, he said that Rotary's collaborative action creates lasting impact. That is, through club partnerships, district and global grants, vocational training teams, and collaborations with healthcare professionals, Rotary can significantly reduce neonatal mortality in underserved communities. That's just a summary of what our facilitator has just taken us on. So you can take down your questions, and when we get to question and answers, you can ask your questions then. Thank you so much, sir, for coming. So we'll quickly move on to our next speaker, who is past President Olusegun Akinwotu, who will be talking to us on maternal and child health initiatives, in maternal and child health intervention to protect the mother and child. I will quickly go through his profile. Just a minute. Yeah, Dr. Olusegun Oladimeji Akinwotu is a medical doctor, public health professional, mental health specialist, and a health educator with a passion for improving the health and well-being of individuals and communities through education, prevention, and evidence-based practice. He earned his Bachelor of Medicine, Bachelor of Surgery, MBBS, from Ahmadu Bello University, Nigeria, and a Master of Public Health from West Coast University, California. Dr. Akinwotu serves as a behavioral consultant with Zen Educate, where he supports children with developmental disabilities by implementing behavior management strategies, fostering positive learning environments, and collaborating with educators, therapists, and families to enhance students' social, emotional, and academic development. He serves as a public health consultant with Luminara Health Consultants, providing expertise in health promotion, disease prevention, community health initiatives, and public health program development. A committed community leader, Dr. Akinwotu is a Rotarian and past president of Rotary Club of M.O.R.E, where he has championed numerous humanitarian and community service initiatives focused on education, healthcare, and youth development. He is deeply passionate about education, health promotion, disease prevention, and community empowerment. His professional interests include preventive medicine, public health advocacy, mental health, healthcare quality improvement, and developing sustainable interventions that improve population health outcomes. He is recognized for his integrity, compassionate leadership, analytical thinking, and excellent interpersonal skills. Dr. Akinwotu is dedicated to advancing health equity, strengthening communities, and inspiring positive change through service, collaboration, and lifelong learning. Distinguished Rotarians, I present our second speaker, past President Dr. Segun Akinwotu. You have the floor, sir.
Thank you very much, our district governor in attendance, district leaders, past district governors, and all Rotarians present. I'm here today to talk about maternal and child health, and then how we can prevent the various complications that arise from having poor healthcare services and outcomes. Maternal and child health is one of the strongest indicators of any nation's health. We wouldn't be able to do appropriate justice on this without actually talking about the magnanimity of the problem. Globally, we have 197 deaths per 100,000 live births in maternal mortality rate. In Nigeria, we have about 500 to 1,000 per 100,000 live births. And then annually, statistics have shown that we have about 75,000 deaths from pregnancy-related complications. In terms of child mortality rate, we have about 115 per 1,000 live births globally, and we have about 850,000 deaths per year in Nigeria. This is very, very alarming, and that is why we have to find a way to profile a solution. We will do our bit as Rotarians, but we need to have at the back of our mind that this problem is there, and there are certain reasons, causes of this problem. What are the causes that we have seen over time? Hundreds of thousands of women die from pregnancy-related complications, while millions of children under the age of 5 die from preventable illnesses. Preventable illnesses like pneumonia, diarrhea, malaria, malnutrition, and complications of premature birth. Most of these deaths are preventable, and this can actually be achieved through the strategies that we'll be enumerating and touching briefly to give relevance to their roles. We have implementation of early antenatal care services, ensuring that we have skilled birth attendants, proper nutrition, encouragement of widespread vaccination, access to quality healthcare, pre-pregnancy, during pregnancy, during delivery, and postpartum. We need to have quality and qualitative healthcare services to ensure that we have excellent outcomes. And then community education, which comes from individual education to the mothers involved, to a level that they are empowered. We encourage education of women so they can be independent and be able to make proper decisions in their homes, and at the same time able to be gainfully employed to support themselves. We talk about promoting, that's key preventive strategies now. We talk about promoting early antenatal care to ensure that women register early as soon as they detect that they are pregnant. They attend the antenatal clinics regularly, and then when it's time to deliver, they get to have their pregnancy monitored. The reason why we emphasize on regular, frequent visits is because pregnancies are different. Some women, you discover during pregnancy, the blood pressure goes up. This has to be monitored while the pregnancy is on. And if the blood pressure continues to go up while the pregnancy progresses, there may be a need to admit the pregnant woman and monitor her in the hospital. And if the blood pressure is still not coming down, not being controlled, there may be a need to bring out the child earlier and place in an incubator while the woman is alive, safe, and then the baby is also alive, being monitored in an incubator till the lungs and other organs are well developed enough to be independent. The next strategy is ensuring that we have skilled delivery facilities. Yes, everybody may not have the required access to tertiary or secondary health facilities, but in every locality, every community, we have the health centers located in the local government. And then we also have trained traditional birth attendants. In as much as at some points they were frowned against, but over time we realized that because of the population, you need them to be well trained and then encourage them to be able to do the proper things so they can also have safe deliveries. And then in situations where they can have skills to detect that there are certain complications inherent, they can refer such conditions to more advanced and skilled centers. There have been cases where in the course of trying to deliver a child, a couple of scans are done in the course of the antenatal visits. And the position of the baby, how the baby lies in the uterus, determines if the doctor wants to continue that delivery directly or they need to do a cesarean section. But those in the traditional birth attendant settings, they don't have access to these facilities to be able to detect that this is a complicated pregnancy. That's why we advise, in as much as some people love to say, oh, my first child, my mother delivered at a particular traditional birth attendant. These days we encourage attendants, pregnant women to attend facilities where all various tests can be done, where you can have the scan done to detect, oh, is this child able to be delivered directly or not? We also encourage the provision of adequate nutrition to support the health of the woman who is pregnant. And then when she has also delivered, she also needs to feed well because she's breastfeeding. And God help her, she also has twins. She needs to breastfeed 2 kids at the same time. So she needs to be properly nourished to be able to give to these children through breastfeeding. So we encourage that they should also have adequate access to supplementary multivitamins to enable them have the required nutrition needed to carry the pregnancy. Going further, we encourage the provision of adequate water, pipe-borne water, safe water for use, because having waterborne diseases, having diarrhea and gastroenteritis, that is disease that causes you to vomit and stool at the same time, is a bad comorbidity. That is an illness that shouldn't happen when you're pregnant. So we want to ensure that everything that is required to make the mother safe is available. Adequate sanitation, proper hand washing, and a very clean and neat environment is also advocated for, because we have also, it has been shown that improved sanitation reduces diarrheal diseases. Beyond the pregnancy and the delivery, because we understand that in the course of delivery, if the process is not managed by experts, the child sometimes may find it difficult to come out through the private part. That is where the baby is supposed to come out from. And it should have been seen that an alternative means like a cesarean section would have been better. But if the child is forced through that narrow canal, maybe it's a big baby, or there are other indications that makes it difficult to come out through, there may be insults to the brain. And this may cause what we refer to as some cerebral palsy or some developmental problems in the child. So we encourage proper attendance of healthcare services to ensure proper delivery. Health education to be able to let the mother during the pregnancy, because there are different things, different signs, different things that occur, different changes in pregnancy. You want to let them know the normal physiologic changes, what they should expect. And if there's a difference in what they should normally expect, they should go and see their doctor and have complaints. So these are very essential in the course of having being pregnant and planning for delivery. Then we'll be going into how can our Rotary clubs help us reduce the incidence and prevalence of maternal mortality and infant mortality, that is, make our pregnancies safer and our children be able to grow to be teenagers and adults. Various clubs, depending on what is obtainable in their locality, in their community, you can have a needs assessment done to know what exactly is lacking in this environment. If you find out what is lacking, is it expertise? Is it the facility to be able to have safe delivery? Is it enough beds? There may be rooms or wards with empty rooms without beds in them. So is that what is required? They have enough manpower, but they don't have enough beds. So you can do a needs assessment to find out what is required to help support to help support promotion of adequate maternal and childcare. So following the needs assessment, there are various strategies we can actually adopt, various projects or programs that can be adopted by various Rotary clubs. These include organizing free maternal and child health outreach programs, where there will be adequate health education, handing out of various flyers and use of posters to educate them, sponsoring antenatal education classes in the various health centers near you, or in even private hospitals. Some private hospitals are known for strictly maternal care. They are called maternity homes. So you could work with those ones too, and then achieve what we intend to achieve to reduce any mortalities or morbidity from there. Donation of delivery beds, neonatal equipment, and essential medical supplies. Funding of immunization campaigns in collaboration with local health institutions. Provision of clean water. Provision of sanitation facilities. You can go to schools or in the community where they have some public toilets. How can the Rotary Club help to improve the facility to ensure that it is sanitary enough for the community to use? And then supporting nutrition programs, ensuring that women are well educated on balanced diets, what to eat and what not, what to avoid, and then the knowledge of staple food items that are easily accessible. Then training the community health volunteers, community health workers is also one of the ways we can help build manpower capacity for those who are involved in maternal and child health care. Distribution of insecticide-treated nets and other means of preventing malaria. We know malaria is endemic. Malaria is a big problem. Malaria causes spontaneous abortion. So it affects the mother. Also in the child, a young child having malaria is also predisposed to a lot of other conditions like cerebral malaria. If a child develops cerebral malaria at a tender age, it may affect the functioning capacity of the brain as it goes up, as it continues to grow up. So these are things we should look at. Establishing emergency transportation support for women, providing scholarships for midwives and community healthcare workers, supporting cervical cancer screening where available, building sustainable partnership. Rotary clubs can maximize their impact by collaborating with local hospitals and available primary health care. Also, collaboration with the Ministry of Health, UNICEF, and WHO programs can be done, can be collaborated with, and then reaching out to community leaders, faith-based organizations, and women groups and youth organizations. So there are lots of opportunities for Rotary to be able to collaborate with various organizations to achieve improved healthcare services to maintain maternal and child healthcare. These partnerships help to ensure that projects continue to benefit the community even long after their implementation. In conclusion, improving maternal and child health is not solely the responsibility of healthcare professionals. It is a shared responsibility. When Rotary invests in healthy mothers and children, we invest in stronger families, healthier communities, and a brighter future. Together, we can save lives, reduce preventable deaths, and create lasting change through service above self. Thank you very much.
Thank you very much, Past President Sheikh Makiwotu, for that session. I'm sure we all gained a lot from what he has shared with us. Just for the benefit of everyone, I've decided to just give the key takeaways from what his presentation has been on. He said that maternal and child health is a national priority, and that safe pregnancy, childbirth, and child survival are essential indicators of a healthy nation. And most maternal and child deaths are preventable through affordable, evidence-based interventions. He also said that focus on preventive health care is key. The presentation emphasizes early antenatal care, skilled birth attendance, proper nutrition, exclusive breastfeeding, routine immunization, family planning, good sanitation, and community health education as the foundation for reducing maternal and child mortality. He also said that Rotary clubs can make a significant impact they can improve maternal and child health by organizing health outreaches, supporting antenatal education, donating medical equipment, promoting immunization, improving wash facilities, providing nutrition support, and assisting with emergency transport for pregnant women. He said that partnerships are critical sustainable success. He said that partnerships are critical, that sustainable success depends on collaboration with hospitals, ministries of health, WHO/UNICEF supported programs, NGOs, faith-based organizations, and community leaders to maximize impact and reach. And finally, he said that healthy mothers and children build stronger communities. The presentation concludes that Rotary has a unique opportunity to save lives and strengthen communities through sustainable maternal and child health projects that deliver lasting social impact. That's a recap of all he has said, and we thank you so much, our facilitator, for that. So we'll quickly just move into question and answers. If you have Rotarians that have questions that they would like to talk, so please kindly indicate by raising up your hand and I can recognize you. We'll just take like 3 questions per facilitator so that we can try to keep to the time that we have allotted. We are already behind time, but we just have a few minutes to take questions and answers. So if you have any question, kindly indicate by raising up your hand and I can recognize you. So do I take it that we understand perfectly what was shared with us, that we don't have any areas of ambiguity? So if that's the case, maybe our facilitators might just want to throw 1 or 2 questions out there and see whether we can get responses, from all the people online. I'll start with our PDG, sir. I don't know whether you have any question you want to throw on the floor, just to ensure that people understood what you have just shared with us today.
Question for the audience. Okay,
Yes, sir.
can anyone share with us basic strategies that can help us to reach the community and deliver our message?
Do we have anyone who can answer that question?
Upon reaching the community, what elements of the community are we interested in, and where?
Somebody said you should repeat the question louder. Probably they didn't hear it well.
Okay, so my PDG, can you please repeat the question louder? They didn't get the question clearly.
What are the tools available to us as Rotarians for working with the community and passing our message, and who are the people we are interested in talking to?
Anyone that can answer that question?
There's a hand up.
Yes,
Oluwa Enito.
Rotarian Oluwa, can you please just unmute yourself and answer the question?
Okay, thank you so much. Good morning, everybody. My PDG, the DJ. So for me, I didn't really get it clearly. It was a bit blurry, but I'm looking at it from the angle of community entry, because I was hearing something about the tools available to us. And then I think that community entry would be a good thing, because Rotary already has like an image and we have worked in several communities. Because we have been established in these communities, it's always easier to come in and get things done. And because of the resources we have, we have Rotarians who are experienced, doctors, nurses, who could guide us, and development practitioners. Thank you.
Okay, so my PDG, can you please repeat the question louder? They didn't get the question clearly. Thank you very much. My PDG, I don't know whether you'd like to react to what she said.
Well, to essentially address the matter, but now we're talking about being able to reach the communities and getting to be part of them as it were through the same methods we use for this assessment, so that we go to the society and get them to understand what we want to achieve, such that when we do that, we have their buy-in, and then they will become the people who are pushing the just go there and make announcements and talk, and they go about the normal, don't listen to us. They just like another man who comes to the street, wants to them and says, repent, and nobody will to that. They just do it. But if we actually gather the community, the leaders and talk to them, face to face, involve the youth, involve the women, take it further with the men, single them out, and talk to them about what roles they have to play in making their wives and children healthier, using information passed on radio, TV, and all that. Then we can actually get the community to understand the message more and get them to work with us when we actually begin to talk about interventions that help the mothers to be healthier and them to be healthier as well. Right? Yeah. Thank you.
Thank you very much, sir. Okay, so just to save time, can our second facilitator, past President Akinwotu, I don't know whether you have any question you'd just like to have the audience.
Thank you very much, our facilitator. My question is this. Last Rotary year, from this goes to any Rotary club. Last Rotary year, what program or project was done for maternal and child health? And following this presentation today, this educative seminar, what would you love to do to improve on that? Thank you.
Thank you very much. Do we have any person that would like to respond to that? Would like to share what your club has done and what you plan to do to improve on it this year? Yeah, Rotary Anayodeji from RCO Ogudu. Please, you have the floor.
Good morning. Good morning, fellow Rotarians. So just to answer the question, my club usually visits Ogudu Primary Health Center. And, again, we create awareness around maternal health, and we also share, pregnancy kits, with them. We do this every year. However, I think there's a new sheriff now at the Ministry of Health. We plan to do this project, the same thing, this year on Thursday, this coming Thursday, but we've not gotten approval yet. And I'm wondering, this is Rotary. They've known us all these years, but there seems to be a new protocol around any organization that wants to visit the primary health centers, which is now a challenge, for us. But in terms of what we do every year, that's what we do every, visit primary health center. We're going to increase it to 2 this year, visit Ogudu and Ojota. But the same protocol. Both of them have told us that we need to write letters, get approvals from the executive chairman of Koshofe local government, which is the one near us here, and the permanent secretary. Thank you.
All right, thank you very much. Rotary Emeka Nwosu, you have the floor.
Okay, thank you, my PDG. Thank you, our PDG, Dede Shoga, and every other speaker. For us at Rotary Club of Ikoyi Metro, what we did last year, we had a very laudable project at Massey Children's Hospital at Lagos Island. But this time around, when we went again, because we've already set up a committee that will go back and do a need assessment, we went with a lot of equipment there last year and consumables for the mothers and the hospital management. But this time around, we noticed that after the committee did their need assessment, we noticed that Mercy Hospital is being moved to a new facility, and we need to shift the attention to another hospital at Oniko, where we have pressing needs. So after the whole assessment, we will be moving in there to replicate more than what we did last year at a different hospital. And we have equally started the awareness section by even starting the month with a topic and getting a keynote speaker that came and shared valuable information to us. And as a club, we're already sitting down, not really even from the input we are getting from this valuable educative webinar this morning. We're already putting stuff in place. How do we take it to the next level? Not just going to the maternal, hospitals to go and donate stuff. And at the end of the day, we just sit back and just fulfill it as a project. We are thinking beyond the maternal health care month. What we need to do as a friends in Rotary, in the same, even collaborating with other clubs if it's possible, so that we can have a more lasting impact in what we are chasing as a club. Thank you.
Thank you very much. I'll take just one more question if we have. Okay, Rotary Adeyemi, can you please go ahead and unmute yourself?
Good morning, my DG, my PDGs in the house. Rotary Adeyemi, our Rotary Club of Bagada. This year, just a couple of days ago, during our DG's visit, we had donations to the primary health center at Spencinema, Songo Primary Health Center. We donated medical equipment and consumables to the primary health center, and to the patients, we did some free screening for blood sugar and blood pressure. We gave pediatric wards and pediatric drugs to the children that were brought to the event, and also we did some donations of delivery kits to expectant mothers. So, and this is what we've done repeatedly. So we're also going ahead in collaboration with 10 other clubs to do another set of donations today at Lasut. So this is what we're doing at Rotary Club of Bagada with regards to maternal and child health in this month. Thank you.
Thank you very much. Fellow Rotarians, I'm sure we had a great time today in terms of education on the topics that have been shared by our highly knowledgeable facilitators, and we'd like to thank them dearly for coming and sharing their wealth of experience with all of us. So just so we thank you so much for coming. Our highly revered PDG, Dende Shoga, and past President Sheikh Makinwotu, thank you so much for your deliverables. And we'll just like to go to closing remarks now. So we'll take closing remarks from our DLF, past President, PDG, Ife Ejeze, and then our district governor, and then we can move on. You have the floor, ma'am.
Thank you very much, PAG Segun Adewoko. You have done very well as the moderator for this morning section. You handled it properly. I appreciate you. Thank you so much. Wow. It's been a very impactful section this morning, very educative. I have learned a lot on maternal and child care, and I'm very sure that every participant here this morning has also benefited immensely, and that what we learned this morning is going to lead us to carry out activities and also projects in our various communities, in our various clubs for this month of July. I expect that a lot of clubs will be doing a lot for maternal and child health. What I have learned in these two sections we have is that we cannot do it alone. Hence, there is need to get collaborations, either with the health agencies, with our fellow clubs, government health agencies, especially educational opportunities, which is what we have done this morning. It is very important. Education is key. Knowledge is power. We have to educate our communities. We have to go to the health centers. We have to educate mothers and children in various ways, either through the media, through the TV or radio, or through community dialogues, by getting the communities involved in gathering these mothers and children and educating them properly or what they need to do. Because the second speaker touched on nutrition, good nutrition. He touched on early antenatal care, which is education. We have to let them know that antenatal care is important to save the mother and child, so that if there's any complications, these complications can be noticed on time. Early detection solves a lot of problem. You get it done. So we learned also know that we have to organize health outreaches. That is this education. So it's not just about going to health centers to donate equipment or to donate to hospitals and all that. Clubs can organize health outreaches for educational purposes. Knowledge, give them knowledge. That will also lead them to know that they have to now visit the health facilities to get the adequate care they need. And then from this morning section, that we can apply for global grants. Most of our clubs, we donate a lot. I can see donations flying everywhere this Rotary year. Nigerians donate a lot to the foundation, but we don't know how to harness from what we have given. We give a lot in terms of donation to the foundation. Let's apply for district grants. Let's apply for global grants to support neonatal care by giving them the necessary equipments that are needed in these health centers to help our mothers and children. This is part of what I have gained from this morning section. So clubs, if you have not applied for global grants, if you have not applied for district grant, you are losing. This is free opportunity, free money. For global grant, you can get as much as $30,000 minimum to help, and then collaborate with hospitals, NGOs. And then the better thing I learned is that healthy mother and child will help to build our communities. So when we build a healthy mother and child, we have also succeeded in building a healthy community. And when we have lesser death mortality in our mothers and children, of course, the community will grow better, knowledge will be shared, and we'll have a more healthy community for all of us. I want to start by thanking the facilitators that have done justice to this program this morning. Our revered PDG Dende Shoga, ever knowledgeable, ever ready to give, ever ready to deliver. He was contacted at a very short notice, because you all agree with me, July was a packed month with installations and all that, and then just coming back from conventions. But short notice, he was able to still deliver and give us what he gave this morning. Our PDG Shoga, God bless you. PP Akinwotu, we keep delivering, picking out good speakers every day, and he has done justice to the topic he was given this morning. We thank you, Shegun Kinwotu. Thank you so much for this lovely delivery. I'm sure when we call upon you next time, you'll also be there for us. What of my district governor who gave us this platform to be able to take this section this morning? My DG, you know, for a DG, it's a very tight program. But he found time, see him smiling, well dressed this morning, ready for this section. And he was there to give the opening remarks as at when needed. It was not late at all. My DG, we appreciate you. Thank you for giving us this platform to educate Rotarians and for also being here for us this morning. You gave the opening remarks, and I can see you very much ready to tell us what you have learned and give us a good closing remarks. Then before you go, I also noticed that a lot of our PDGs were on this morning. Oh my God. How will I appreciate you? Our advisor for the district learning facilitator, PDG Kola Shodipo, he was here on time and stayed all through the session. PDG Kola, we appreciate you. PDG Kamoru Omotosho, ever ready on time. Time is also a problem in our management. He was here before 8 o'clock and was chatting with us before the section started. PDG, revert PDG Kamoru Omoto, we appreciate you so much. Thank you. I'm sure we'll be learning to keep to time, fellow Rotarians. The earlier we start, the earlier we log out. So thank you. I also saw our district foundation chair, Jide Akerodolu, PDG. Thank you so much for being here. And we appreciate you and all you do. Our DGE incoming, Uyi Show will be. Thank you. She was here all through the section and she was here till the end. I appreciate all of you. Thank you so much. I also want to state that for this section, as short as the notice was, we had at least 75 participants who listened to this lecture this morning. And I want to say, if you have enjoyed this lecture, this section this morning as a Rotarian, and you have gained and you have benefited from the knowledge that was imparted this morning, don't keep quiet. Talk to other Rotarians. Tell them what you have learned. More importantly, spread the word, because another section is coming up next month. This online training section will be on every month to carry on with our team for the month. So there will be another one next month. Spread the word and then advertise it as we put it on your platform. Put it on your club platforms. Encourage your fellow club members to attend, because knowledge is power. I want to also appreciate the coordinator for district learning facilitation, Akin Tolu, who helped in putting all this program together. Akin, thank you so much. He did not rest at all. He was so worried because of the shortness of the time, and all through the night he was calling me up, and till this morning. Akin, I thank you for your tenacity in making sure that this program ran smoothly and that everything went well. We appreciate you. Thank you. As I hand you over to my district governor to end the section by giving us a wonderful closing remarks. Thank you, my DJ.
Thank you, my district learning facilitator. I'm very grateful for the energy which you are putting today, and I thank everybody for participating. Just yesterday, I inaugurated the Maternal and Child Health Committee, and I think education that we have seen that is the way to go to reduce maternal mortality and infant mortality is the way to go. IPP Claire Masheye is chairing a legacy program on education of maternity workers, doctors, and midwives. So I will link her up. I want the president, impactful presidents, to link up with her to see how we can use the money queens that will not cost between more than 3 to 5 million to actually teach the right techniques for infant resuscitation and for maternal care. Thank you very much, everybody, for coming in. My DLF has done justice to thanking you, so I can only say thank you very much. See you next time. Have a wonderful Saturday.
Thank you very much.
Thank you, fellow Rotarians. Thank you, my DG. Thank you, fellow Rotarians, for finding time to be here. I look forward to seeing all of you next month when we call upon you for the next learning section. Thank you, PAG Shegu. Thank you, moderator. Thank you, Akin, for coordinating this. I appreciate you all. Love you.
Thank you. Bye-bye.
Thank you so much.
Bye-bye.
DLF
Have a wonderful weekend.